Hi, this is Dr. Kingston, and in this video I'll be going over the muscles of the tongue. Our objective here is to name the intrinsic and extrinsic muscles of the tongue and discuss their origins, insertions, and innervation. The muscles that make up the tongue can be divided up into intrinsic and extrinsic. The intrinsic muscles of the tongue are located in and actually make up a lot of the bulk of the body of the tongue. They're going to function to change the shape of the tongue without moving it around in or out of the oral cavity. These are all innervated by the hypoglossal nerve, and they include the superior and inferior longitudinal muscles, which are going to shorten the length of the tongue by pulling the sides in like so. The vertical fibers, which will flatten the tongue by pulling the top down in and the bottom down in like that. And then transverse fibers, which are going to narrow the tongue from side to side. The extrinsic tongue muscles are the muscles that actually move the tongue around. So they have connections to both the base of the tongue and surrounding structures. These are typically named for the structures that they attach to. So we have Palatoglossus, which is this little guy right up here. Palatoglossus runs between the soft palate and the tongue and functions to elevate the tongue. We have Styloglossus, which is another elevator of the tongue, and that is going to connect up to the styloid process of the skull. Genioglossus, I'm actually going to show you over on the drawing over here. Genioglossus is this fan-shaped muscle that originates from the genial spines on the anterior medial mandible and fans out up into the body of the tongue. When this fires, it's going to pull the tongue forward or protrude it out of the mouth. I want to note here that there are two genioglossus muscles, even though they're originating from that medial point on the mandible. Sometimes it looks like there's just one. If you fire one of them at a time, so you fire them unilaterally, it will also deviate the tongue to the contralateral or opposite side that it's fired on. All right, and finally we have Hypoglossus, which I'm going back over to the photographic image here. Hypoglossus is a depressor of the tongue, so it attaches down to the hyoid bone and will pull the tongue downward toward it. One of the nice things about this group of muscles is that they almost all share the same innervation. The hypoglossal nerve, cranial nerve number 12, exits the cranium through the hypoglossal canal, and then it's going to travel anteriorly and inferiorly through that anterior cervical triangle. It enters the oral cavity by slipping deep to mylohyoid. So here's mylohyoid, and here's that hypoglossal nerve going just deep to it to get into the oral cavity, and then it's going to approach the tongue from an inferior position. This lets it supply motor innervation to Hypoglossus, Genioglossus, and Styloglossus, or 3 out of our 4 muscles. That fourth muscle, Palatoglossus, is the exception to this rule. So because it originates from the soft palate, it actually shares its innervation with other soft palate muscles. And because the soft palate is largely in the pharynx, it has the pharyngeal innervation pattern. So these are getting their somatic motor innervation from vagus. And those are all the muscles of the tongue. So here's a practice question for you. The correct answer here is B. A motor deficit for the right genioglossus muscle would produce a reaction where your patient's tongue deviates uncontrollably to the right when they try to protrude it. All right, so let's take a look at that genioglossus muscle to understand it a little bit better. We often see it depicted looking like this, like a straight fan that comes into the body of the tongue medially. But in actuality, the situation's a little more complicated. If we look at genioglossus, there's actually 2 of them here, right down the middle. Over here on the picture on the right, we can see that it is not oriented just straight up and down, but these fibers are directed superiorly and laterally. All right, let me erase that now for a second. That means that when these muscles fiber, they're going to pull the tongue forward, yes, but they are also going to pull the tongue out toward the opposite side. So if we have those fibers attaching here on the left side of the tongue, when they fire, they're going to pull this way. That means that if the left genioglossus muscle is functioning correctly, it will pull the tongue toward the right if it's fired just on the left side. So if we have a motor deficit over here on the right, that means that there is no counteracting right force, okay? Usually the right would pull the tongue toward the right and forward, and the combination of those two actions would end up pulling the tongue straight forward or protruding it straight out of the mouth. But because we don't have a functioning right side here, that left or that rightward tilt that's produced by the left side genioglossus muscle is never corrected, and we end up with an uncontrollable right deviation. Thank you guys for watching.